No.
Hello, hi, Dr. Nidhi. We can't.
Yeah, hello, Sanya.
Hello, hi.
Yeah, I'm heard.
Yes,
Yeah,
yes, I can
I
see.
must.
Okay, great, perfect. I think we're already live. Vatsal, are we
Hmm.
live? We're just checking if we've gone live already or not.
Yeah.
Okay, perfect. Okay, great, we're already live. I am just cross checking once. And we also have a few viewers joining us. So we'll wait for 2-3 more minutes and then we can
Yeah,
start our
sure. Hmm.
webinar.
Yeah.
Thank you for connecting with us on a weekday at 8 p.m. We just thought it would be
Yes.
a convenient time for doctor and patients and all viewers to
Patience,
connect.
correct.
Okay, great. Uh, Okay, great. Very happy to have you here with us, Dr. Nidhi. Thank you for
Yeah,
joining
thank
us
you,
again. I
dear.
think we once every few weeks we find a way to catch you and have conversations about infertility, and they've been so helpful. We've gotten such great feedback, and we thought why not do another one? And you do such a great job
Yeah,
at
even
explaining.
very happy to talk to patients also.
Yes, definitely. And you do such a great job at explaining what is right, what is wrong, and clear the confusion. So I welcome you. Would like to welcome Dr. Nidhi, who is a senior IVF specialist at Kinder Hospitals, Bangalore. Today's topic
Thank
is
you.
something that we're revisiting today, which is uncovering what's behind your infertility. We've talked a lot about, okay, what's a good age to start conceiving, what are some problem areas, but there are a lot of questions that go unanswered, and there's a lot of confusion around why maybe sometimes people feel everything is fine yet they're not able to conceive. So this is going to be a very insightful, informative webinar. And my first question to you, Dr. Nidhi, is when should a couple start suspecting that they might be dealing with infertility and it's not just taking time?
Okay. I say, irrespective of age, if a couple is trying for more than 1 year, then definitely they should visit the doctor and get it evaluated. See, there is nothing wrong in getting just basic evaluation done, irrespective of your age. But in case you are plus 35 years of age, then 6 months is enough. Then that becomes an emergency. You should definitely go and get it evaluated.
Okay. So above 35, trying for about 6 months is an accurate
Six
timeline.
months enough.
If you're younger, then what would be the timeline? About a year?
Yeah. 1 year is actually, see, pregnancy is a thing which should happen to everyone naturally. There shouldn't be any assistance needed. Nature has created everything like that, that it should happen automatically. But in case if there is something wrong, that means something is going wrong, which is not hampering you to conceive, then definitely you need to visit and get it corrected.
Okay. Okay, so above 35, 6 months, and if you're younger, then obviously you should be able to conceive naturally, but waiting
Yes.
about a year and going to a doctor
Yeah, it's
post a
more than
year
enough.
would make sense.
Yeah.
Okay, so now to start off, I want to ask you what are some, early signs that could be like
Mm.
recurring symptoms,
Mm.
maybe irregular periods or
Yeah, where
painful
you should
cycles,
visit.
ovulation. What are some
Correct.
things that should prompt someone to get
Visit
evaluated?
early. Yes, correct. See, if a patient say they are getting very delay cycle, already they know that PCOS is there for them. In PCOS, what happened? Most of the cycles will be anovulatory. Although you are getting period, it doesn't mean that you are ovulating each cycle. So ovulation check is very important. Not just for PCOS, for any patient. Not all cycle will be ovulatory cycle. Some will be ovulatory, some will be anovulatory.
Okay.
Okay. And if this happens frequently in PCOS cases, so PCOS cases should come and visit doctor early. Then if there is severe pain during period, then chances of having endometriosis is more. So that need to be taken care. Then any other symptom, like if you are diabetic, if you are hypertensive, if you have thyroid or any other medical condition, then again, because everything is related to your fertility, everything is related to your ovarian and sperm health. Okay, overall hormonal imbalance will cause a negative impact on fertility. So these kinds of couples should definitely visit early rather than waiting and getting it evaluated. It already becomes late.
Okay.
So come early so that we can have better solution for them.
Okay. I have two small questions here. You mentioned ovulatory and non-ovulatory
Mm.
cycles, and you also mentioned PCOS patients coming to you early. So could you
Mm.
help us define what early would mean for PCOS patients?
See, if you know your cycles are delaying all the time, you if you are a little bit obese, your cycles are delaying. Say you are hypothyroid also. So in these cases, it's best not to wait even for 1 year. As soon as you are thinking that you want to become pregnant, say may 1 or 2 cycles you have tried naturally, still you are not able to conceive. Just come get certain tests done so that the level where you are right now will be able to help you with that. Yeah, how much time do you have and how much urgency is there to correcting?
Okay. And you talked about ovulatory and non-ovulatory cycles. What about those?
Ovulatory means, see, you get period every month regularly. Say you are getting in 30 to 35 days or 40 days period. And you are thinking I'm getting period every time in whatever interval because each person have different cycles. So I am getting an interval. So that means you are considering that egg will be getting released and that's the reason I'm getting period. That is not correct. You will get period. There is one uterine cycle, there is one ovarian cycle. The job of ovary is to release the egg. Actually, both are dependent. But when hormonal imbalance is there, uterus will perform separate and ovary will perform separate. It may not release the egg, but still you will get the breakthrough bleeding because of estrogen lining will increase. Progesterone is not there to help out. So once the lining increases so much that uterus will not be able to withstand it, you will get the bleeding.
Okay.
Thinking that that's a normal period. But actually that is not because there is no progesterone, no ovulation.
Okay.
But still bleeding is there.
Okay.
That we call it as withdrawal bleeding.
Okay. So I imagine this can only be, tested by a doctor, and it is very hard to tell on your own whether you have. Okay.
Yeah, whether you're ovulating or not.
Yes. Okay, that was very insightful. I'm sure this is something that people would not have known. My next question to you is, we do hear of people getting pregnant but going through repeated miscarriages. Now, is this also a good time to see an infertility specialist?
Yeah, I'll just tell you. I'll give you one example so that will be that will give all the viewers clarity also about it. See, I had one patient of repeated miscarriage. Repeated miscarriage means two or more than two miscarriage. Both times she conceived naturally. Everything looks okay. Husband count motility also fine. And basic evaluation, they have not done the advanced evaluation. Just basic at basic level they have just done certain tests and then they came to us about to see what can be done further because already she is aborted 3 times. So now here there is no problem in conceiving. The problem in repeated miscarriages to retain the baby, to carry on with the pregnancy till the term. And generally these kinds of patients, if they are aborting before 3 months, 90% chances of chromosomal abnormalities are there. So we evaluated for chromosomal abnormality. We found out the husband is having translocations. So rather than trying naturally, because in natural we don't have any control. Again, the baby may be anomalous. Again, the abortion may happen. So we did one IVF cycle. Along with IVF cycle, we added this genetic test of embryo. Before implanting, we will send the embryo cell to test for that particular translocation and overall chromosomal evaluation. So you will come to know which embryo is healthy and which is not healthy. So the euploid, we call healthy embryos euploid embryo. Once you implant the euploid embryo, chances of getting pregnant plus carrying pregnancy till term and delivering a healthy baby is very, very high. Now the patient is having 10 months baby. All healthy, all good. So that is what the difference it makes.
Okay.
You keep on trying naturally and without taking help, thinking that I am conceiving every time. It is just a miscarriage which is happening. Some basic evaluation you do, but it may not help you. So you need some detailed evaluation and detailed help.
Okay.
But yeah, definitely conception is possible. Healthy pregnancy is possible.
Okay. So it is important to know when to get tested in depth. Okay. I think this gives rise to another question is, there are times where everything seems fine. Like you have an ovulation cycle is fine. Your count and mortality looks okay. Tube tests and everything is fine. But even then, no natural pregnancy happens. What would be a, scenario where this would happen?
Yeah, first I'll tell you this is the most common question which people come and they come into OPD and ask the same question. And I think most of the couple watching here, they may relate to this also because everything seems to be okay. Age is also fine. And then we are checking our ovulation. That is also happening. Tube test is fine. Husband, motility, everything is fine. Then where is the problem? Why are we not able to conceive? Then answer to this question again lies with one example. I'll set another example for this. See, one couple came to us looking apparently everything okay. Then we did further detailed evaluation. We found out DFI is very high for the person. Then we started certain medication for them, and then DFI is corrected, and they conceive. 2 months later, they conceive. This is one example, and these kinds of examples, many examples I have. But see, because to understand this, why are we not able to conceive? There is little bit science in natural conception. What happens here till in natural conception or IUI? Say IUI also we are trying. We can help you as a doctor as per how much ever we can help you is till ovulation. We'll make sure that your egg should come out of the ovary. Then after coming out, whether it is taken by the tube, whether the sperm were able to reach the tube and fertilize there, because fertilization happen only in tube. Then this after fertilization, whether the embryos come and implanted to uterus, these are like big queries. We don't know because there is no way. You cannot see the tube in scanning. You cannot see egg is microscopic. You cannot see the egg. So these are few checkpoints. Because of these checkpoints, we cannot be sure what is actually happening inside. And there is something which is patency of tube and there is something which is functionality of tube. Maybe tubes are open. That is another thing. But they are not very functional. They are not able to collect the egg. The alignment to ovary is not good. Shape of tubes is beaded, coiled. So they are not able to carry the egg. So those all things, roughly you will able to see in HSG and even with the laparoscopy, you will have better idea about the tubes. But it's still that functionality, carrying off egg is quite big question mark. So most of the natural pregnancy will fail at that site. Okay. To give answer for this, you need a detailed evaluation for that. Okay. And these are the cases which are most difficult to treat, I say. Because when you don't know where things are wrong, then you have to evaluate everything and correct the thing. So this comes in unexplained infertility.
Okay, so like you said, I think it's reiterated that there is a big importance for evaluation. So even for people, it seems everything's okay, but it's possible that it isn't. Okay, so I think then this takes me to our next part of this webinar, which is talking about diagnosis, which is, say a couple has come to you with all of these concerns. Now, what is an initial diagnostic step that Kinder Hospitals, does? What are the first few things that you evaluate?
See, there are 3 basic tests which is needed. Say the couple is coming for first time. They have never underwent for any kind of treatment. So we would like to see for ovarian reserve from women. We'll do for ovarian reserve, we'll do one basic scan so that we can see the ovaries also and we can see the uterus also. We can evaluate for any myomas or adenomyosis in uterus. And we can check how many eggs are there in ovary. It can be counted in scan. Okay. So that 2 things from women and one simple semen analysis, basic semen analysis as per initial evaluation we can have. And if count motility comes subnormal or anything, then we go for detailed evaluation. But as per initial step, 3 things will give you better idea of what kind of treatment or how depth you have to go for evaluation.
Okay. So after this initial diagnostic step, please correct me if I'm wrong, doctor. From what I know, there are female factor diagnosis and male factor diagnosis. When it comes to female factor diagnosis, which I'm sure is a prevalent question.
Okay.
What
female
checking for like just AMH and scans? What else is there to test for?
Okay, so if I'll talk about female factor diagnosis, as I told you, tubes are again very important for natural pregnancy. See, generally, if a patient comes, I do not jump on direct all the investigation and evaluation. I give them 2 months good time for natural conception. Still, they are not able to. Still, I make sure the ovulation should happen. After ovulation, also, if patient comes without conceiving, then I'll go for third step will be tubal evaluation. So it can be done by HSG, it can be done by laparoscopy. Laparoscopy is actually gold standard. HSG will give you the idea of tube. It will not help you in opening the block. But the histolaparoscopy, then and there you can correct the tubes also.
Okay.
So that option will give. And then being negative positive results are not there in laparoscopy. Whatever it is there, it will show you. So there are two kinds of, you can evaluate the tube. If tubes are also healthy, then we go for detailed male evaluation. Maybe sperm count, motility, everything is okay, but the DNA factor, which we cannot see like that, that may not be working correctly. So in that case, male evaluation, if we go for further male evaluation, then we have to see for DNA factor also. So we can do DFI for that. Then there is karyotyping if needed. If there is any history from family side, if there is any history of abortions, then this karyotyping also we can do.
Okay.
So it basically we evaluate the person based on problem. Multiple abortion, there will be separate panel of evaluation. If age is okay, there is separate panel of evaluation. If they come to advanced age with other certain issues, thyroid, sugars, and everything need to be seen. So there is certain panel of evaluation. So based on age, we will categorize the patient, and based on other factors.
Okay. So for us to do an in-depth evaluation, the initial diagnostic process would help us get insight into what needs to be tested.
Yes, what needs to be tested further. Correct.
And I was curious, doctor, do we also check for sperm function or DNA fragmentation for male factor diagnosis?
Yeah, for male factor diagnosis, we definitely want to check in certain patients, not for all the patients. I suggest DFI. It will not jump to higher evaluation. Here, I'll give you one example. One patient was there. They have come to me. Already they have done one IVF in some other center. Then apparently everything looking okay, borderline AMH and count motility also, it was not very bad that you need to worry about. Then when they have come to obviously they will have questions, why it has failed, why the embryo has not come. Then the problem was none of the embryo could come good. And till day 3, the embryo grown good. After day 3, they have deteriorated. So then we went for detailed evaluation of the patient. We found out DFI is very, very high. It is plus 45. So we started for 2 months of medication. And all the factors were looking positive apart from this. So we retested DFI after 2 months. It came down to 20%. Then rather than jumping to IVF directly, I thought I will give a best try for IUI. Then I gave a good trial for IUI for this couple, and they conceived with first cycle life IUI. It is like if you evaluate properly, if you cure the root cause, then that means you don't have to jump always for higher treatment options. So based on other factors also, you can decide the treatment options. As I told you, this patient conceived only with IVF. One IVF failed cycle, they conceived with the IUI. The possibilities are always there.
I think this is a perfect segue into my next question, which was, once we know the root cause, we've spoken so much about it, how do you decide whether a couple needs lifestyle changes, medication, IUI, IVF? Like for example, for this couple, you mentioned that they use IUI. I'm curious, could lifestyle changes have helped them towards natural conception, or did they really need the IUI? Like how did you make the best decision in this scenario?
See, if I'll talk about lifestyle changes, they are not optional. Lifestyle changes is mandatory, not just for natural cycle or IUI. It is, or IVF. It's nothing like lifestyle you have to do only in IVF.
Yes.
Once a patient is planning for pregnancy, either they are coming to doctor or they are trying naturally by themselves or whatever it is. Lifestyle changes are mandatory. They have to follow one exercise schedule. Any kind of exercise is okay. At least 4 to 5 days a week. They may choose yoga, they may choose walking, they may choose running or gym, strength training, anything. But certain kind of exercise, at least half an hour a day, is definitely necessary for both. It's not just for women or men. Everything goes for couple. Then leaving smoking, alcohol for both. Any kind of drugs or anything. Okay, all those things need to be taken care immediately. Then focus on diet. High protein diet, include nuts, green leafy vegetables, citrus fruit. All those things are rich in antioxidants and folates. It will improve your fertility. So all the and plus sleeping pattern, reduce uses of Wi-Fi, avoid heat generating things, and then 8 hours proper sleep. These are the things. Plenty of water, increase water content, at least 3 liters a day. They are mandatory. That everyone has to follow this. If I start IVF cycle also for patient, I'll never tell them to have bed rest or anything. I will always tell them just work out, be active, do your routine work, go to office also. You don't have to take leave for that. This treatment is long and it's going to take time. But I want them to be very, very active. And that impact of being active and lifestyle changes, it is shown in treatment. See, it's not just lifestyle will help you in treatment, because see, this impact is from the childhood, whatever toxins you have been exposed till your age. The egg and ovary will respond as per that. Changing lifestyle for a month or 2 months is not going to do magic. But definitely it will give you better, much, much better results for treatment. As a doctor, my half of the work is done if you follow certain lifestyle. At least the results will be much, much better.
So treatment works better if you are healthier
Yes.
and take care of yourself,
Yes.
which is, I
Yes,
think,
correct.
a good takeaway in general. Only healthcare will be able to help you if you are helping yourself first.
Yes, correct.
Okay, so I
That is
think
true.
this makes me ask you. You've shared some wonderful examples of patients being helped through IVF and IUI. I'm curious, if every couple has a unique root cause, does that mean that IVF needs to also be personalized?
Yeah, definitely. We go for personalized IVF only. I don't have any protocol which says all patients are same. Okay. It depends on patient age. It depends on their ovarian reserve, body weight. Then there's body mass. Everything we need to take care and then come to one specific dosage for them and the days of requirement of injection. That is also different. Not all patient will need for 10 days injection or 12 days injection. Some will respond in 10 days, some may take 12 days, some may take 15 days also. You don't believe, I have one patient, for her, I have given injection for 25 days. I was little bit doubtful, should I continue injection? Because generally 10 days patient will respond. But if this patient is taking so much of injection, that means something is wrong. But still we tried. We got single oocyte, means single egg we got in IVF cycle. We have implanted a single egg and she resulted in healthy pregnancy and delivered a full-term baby.
Oh, that's lovely.
So unless you try and see, you cannot be sure of it. And each patient will respond different. So based on patient and based on their needs, based on their evaluation, we have to come to one treatment protocol for them.
I just want to reiterate. So, say for example, a woman or a man, if two women have the same issue, same biological problem, even for them, will the injection dosages, the timings, will
Yes.
those also be different, or will it be the same?
Yes. No. It cannot be same for, see, first of all, person, maybe issues are same because all will come to conceive.
Yes.
Yeah, but maybe same, but 2% cannot be same.
Okay.
So the dosage will definitely depends on the person. So based on the person to person, based on evaluation, we have to decide the dosage. And we can go for either there are different types of IVF also. There is one conventional IVF where high doses are needed. Then there is one IVF light also. I tried for many patients and they respond magically. Here we will just include little bit of oral medicines rather than total dose, depending on total doses of injections. We give some supplements to improve their ovarian reserve. Then we add on some supplements so that the egg quality will come out better. So overall injection need will be reduced for these kinds of patients. So taking less injection, getting better results is sometimes we get in IVF light. We call it a mini IVF, IVF light. Many names are there. So, but yeah, then again you have to select patients specifically and wisely for this, whether the patient is going to respond to your low dosage or not. Okay. So this ovarian reserve, then age of the patient, weight of the patient, everything we need to take care, and then we have to see whether the patient is for IVF light or we should take it for conventional IVF. So these all things we just go into detail and then decide best treatment for the patient.
Seems like a very difficult task to be able to understand their history, their issues, their present state of their health, their lifestyle, and then to be able to prescribe them a certain treatment plan. It must be, I think, very a very difficult task to be able to get it right, and to be able to support the couple in the way they need. I want to
No,
ask,
ultimately,
yes, please.
the aim is not just to become pregnant. Aim is to give them healthy child, healthy delivery.
Definitely. I think so, yes. I think that's so right. I think people might have like a tunnel vision and focus on getting pregnant, but it is also important to be healthy when you're pregnant and deliver a healthy baby. Doctor, I want to ask you, I'm sure there are couples that come to you after failed IVF cycles and after failed treatments. Then how do then at that juncture reevaluate and rebuild their treatment plan? How does Kinder, rebuild their entire treatment plan?
See, at Kinder, we have all advanced facility. Our lab is very advanced. Our embryologist is fabulous. So, and you don't believe me, I will get lot of failed patients. Those who have failed outside, reason being embryo is not good. So implanted, but maybe aborted. But here we go for genetic testing also. We go for all kinds of advanced sperm selection techniques, so that we can have best gamete for them and best embryo can be formed. So once embryo is healthy, once you have the good embryo, automatically pregnancy will happen. And then pregnancy can go till term and deliver a good baby also. So taking care of all advanced technologies we are using for patients, those who come with previous fail cycle. Because here in previous fail cycle, you cannot go anywhere wrong. When they come, the aim is to give them a healthy child. That's all, whichever way. So to take care of that, you need to go into detailed evaluation. Maybe some advanced technologies you need to select for gametes. So if you do that, definitely results will be there.
Is it then possible, say if they come to Kinder, is it possible for them to, for us to understand why their cycle failed?
Yeah, definitely. We'll try to, that's what the first question they will have. When apparently everything, I have one patient, now ongoing cycle. Okay. One IVF already failed. She came to me on the day 2 of cycle itself. That is the last one patient only. So everything is very fresh and I remember each and every details of that. Patient age is also okay, not very much, like 33, 34 years. Husband factor looks okay. And then she has done IVF somewhere outside where embryos have not formed good. Although ovarian reserve also okay. I can see some 10 eggs in both the ovaries. Looking everything looks okay, then why it has been failed?
Yes.
Then we started certain medication for wife and husband to take care of their mitochondrial health and take care of their DNA health. It has improved the equality further. Then next cycle we went for IVF and we got fabulous embryo. You don't believe, we have many fabulous embryo. It's not just a single embryo or 2 embryo. We have multiple embryo. Almost I think 10 embryos are there and that's also very good. All of them. So now it's just we have to implant. If embryo is good, 70 to 80% chances of pregnancy is there. So the only why they fail, because people are not able to manage to get good embryos. If you can able to get good embryos, and if needed, we can do genetic testing of embryos also to check whether the embryos is euploid or not. Genetic testing will almost 90% make sure the pregnancy will be there.
I imagine that being such a happy moment for the couple when they were able to understand what the problem was in Kinder, and you were able to help them. I can just imagine how happy they must be. We're going to now segue into the last part of the webinar. We have about 10-15 minutes remaining. We're getting a lot of interesting questions. There's someone called Preetham. They would love to get on a Zoom meeting with you, but we will definitely share a consultation link where you can book a free appointment with Dr. Nidhi. But their question is, if we go for IUI, will it be successful?
Preetham, I'll say you have to come and talk to me once about this, because see, I don't know your age, I don't know what's the issue you're having, I don't know your married life. There is no clarity on that. If we can talk about these details, then definitely I will be able to help you whether the IUI will be successful for you or not. See, IUI, if patient chosen correctly, then definitely IUI will work. I have one patient who is already 34 years and husband is 36 years. So looking at the age, everyone will jump on a direct IVF. Will go low ovarian reserve, borderline ovarian reserve. I gave one 200% shot of IVF that I will try best IUI for the patient. I will take care of sperm wash. I will take care of how do you insert. That is also a technique. Doing IUI, there is some specific point during performing of the procedure you should have to take care. So we took care of all those things, and then patient is pregnant now. Almost 7 weeks she is now. So IUI is a shot which has to be done carefully and based on patient. You have to select the patient. So if I know the details, definitely I'll be able to help you more.
Pritham has also said husband age 39, wife age 39. If we go for IUI, will it be successful? I think Pritham, you should meet Dr. Nidhi for sure, and I'm sure she'll be able to help you. We'll move on to the next question. We're being asked, how long does IVF take to work on someone who is 30 plus?
See, IVF is, there are two types of transfers are there in IVF. Overall, making up embryo will take 15 days. Women will come on second day of period. There will be some injections, the same hormones which are there in her body. Every day she will take the injection. Once the egg is mature, maybe it may take roughly some 10 to 15 days. We will do egg pickup. We'll take out the egg with single needle. We'll take out, so it's not a major procedure and almost pain-free. Then we'll make the embryo. And then there is one fresh transfer, and the same cycle will transfer the embryo. So you will get to know pregnancy by end of 1 month. But here the problem is results will not be very promising. Due to injections and hormonal imbalance, implantation window will shift. So implantation will decrease. It will give you 30 to 40% result in case of fresh transfer. So generally, as a doctor, I do not prefer fresh transfers. And then it depends on the patient factor also. If you have surplus embryo in hand, definitely you can go for fresh transfer. If you have less embryo, then you should not be wasting each and every is important. So you have to keep it for proper cycle. So, and then there is one frozen embryo transfer, which will give you almost 80% result. Then here we have to give months break. That will be like totally break. Nothing major will be there in between. Then last 15 days we'll prepare the endometrium and we'll transfer the embryo. So another 15 days you will come to know about the pregnancy. So you can say first 15 days in this and last 15 days. And there will be break of 1.5 months.
So about 2.5.
Overall, 2.5 to 3 months in frozen embryo transfer.
Okay, I hope that answers your question. We have another one coming in. They say, how will the medication replace or control natural ovulation, and what signs should we watch for?
Okay. How does medicine replace? See, medicine is not replacing natural ovulation. Okay. If you are ovulating naturally, medicine is just boosting that. It is making sure that you should, as I told you, you may ovulate, may not ovulate. So rather than taking chances, giving medicine will make sure that you should ovulate. That one thing. So there is nothing like that. Ovulation is natural. Medicine is boosting it. Okay. It is helping it to come out. Sometimes the egg will grow, but it will not come out. It will make a cyst inside. So if you give this HCG injection, we'll give for ovulation. So that will make sure that it should come out. So it is just boosting it.
Pritham, we will share with you a link where you can book in an appointment with Dr. Nidhi. Be rest assured, it will be added to the WhatsApp group as well as the description of this video. We have another question coming in. They're saying ovulation happens, but egg quality, how do we check for it?
Yeah, see, dear, egg quality, you cannot check in the natural cycle and IUI cycle. See, when we see this scan, we see one follicle growing. We never say egg growth. It is just a generalized term which is used, but ideally you should not never say, because we cannot see egg. This is microscopic. Whether the follicle is empty or it has or egg, that is also a query. Not all the follicle which grow will have egg. Some will have and some will not have. So that is not possible to see in natural cycle and IUI cycle. We presume that if follicle is rupturing, it is coming out, that means the egg must have come out with that. That is the presumption. But there is no surety of it. Here, where the natural pregnancy and IUI fails.
Okay.
Because everything is question mark, as I told you that during initial talk,
Yes.
this everything is question mark. That's why you get lower results, because you cannot see the egg quality. But yeah, certain things, if a patient is having PCOS, if very low ovarian reserve, or is severe hormonal imbalance, hypothyroid, and long-term diabetes, all of them will definitely have little lower egg quality because of hormonal imbalance. So that we can suspect it must be little low, but until you do IVF, until you see the embryo, you will not be able to check for the egg quality.
Okay. Doctor, there's also someone asking, should the husband and wife do they both need to go through tests? Which is also a question that I have. Is it possible that both the man and the woman are contributing some aspect to the overall, infertility?
See, definitely, baby is for both. I cannot do anything with egg. I cannot do anything with only sperm. Okay, once the sperm and egg interacts, then only a baby is formed. So definitely, it is a evaluation of a couple, and not just evaluation. I said treatment is also for a couple. Although women has to undergo these things little more, but that's the nature. We cannot do anything about it. But actually, there can be problem for both the sides. See, that was a different time when I started my practice. It's been 15 years for me in this infertility practice. And when initially I started, I used to see more of a female infertility. But as the time changes, equally there is male infertility.
Okay.
Almost I think 50% of patients are coming. Not 50, then definitely 40% is male infertility. And almost 80% is like both the factors are involved. Some part from male side, some part from female side. So that is one-on-one. So you cannot say only female evaluation is needed or only male evaluation is needed. Problem can be from both the sides. So both the sides need to be evaluated and corrected.
Okay, makes sense. Doctor, we're just going to ask a few last questions if the audience has. There's one that's coming up is, if IVF has failed once, should we try a new approach or try IVF again? And additionally to this, I would like to ask, say if a couple has come with you after a failed attempt, does the body also need some time to heal from that failed attempt, or how long should they wait then to start a new cycle or to start a new treatment?
Okay, I say that again depends on what is the reason. See, definitely it needs 1 month break to 2 months break for them. But yeah, after 1 month also we can try, because see what happens, this whatever injection they have taken in first cycle will work only for 3 months. Injections are short lasting. That's why they do not have any major impact on your health later on, because hardly 1 month they will, 3 months they will last maximum. So if you have done 1 month IVF, then give 1 month break and another month you can try, so that the results will be little better, expected to be little better, because 1 month already you have taken the injection, that impact is still there. So the chances of getting better oocyte quality will be there. But now this question comes whether you really need IVF and all. That depends on why you underwent IVF for the first cycle, what is your age, and what are the associated factor to it.
Okay.
It's not necessary that you have tried one cycle at a time. That means you have to go for IVF only. We can just evaluate and see what is the best treatment for you.
Yes, I think.
But yeah, if plans of IVF is there, then it's best to give 1 month break and directly go for next cycle.
So I think it makes sense. Even if you have a failed attempt, you would still need to do an in-depth evaluation as to why the attempt was failed.
Correct.
Another question, doctor. They ask, what is the cost difference between mini IVF and conventional IVF, which also makes me ask you, I'm sure there are a lot of couples that come in with a lot of emotional and financial stress, and what is one advice that you give to them to, maybe make them feel better and make them feel reassured?
Okay, see, I'll start from very first consultation. When the patient comes to OPD for very first consultation, it is going to take at least 1 to 2 hours time. So whenever they come to first consultation, I request all the patients to have some time in hand and come. Because to understand their problem, I may take some time. Even to make them understand what is their problem, again, I will take some time. Then again, sometime we'll go for evaluation also. One basic scanning, certain blood tests will be there. So all those things, at least 1 to 2 hours are needed. Then see, at Kinder we have very good financial counselors. We have very good psychological counselors, which take with the counseling session will keep on going hand in hand. It's not just for IVF patient. It is like overall fertility treatment is emotionally draining. It is financially draining and physically also, I say. And there is a lot of hope associated to it. So that hope should not go down. There should not be any negative, because see, if patient is positive, some of my work is done. If patient is positive, chances of becoming pregnant are even more. Overall hormonal stress will not be more for the positive patient. And I will give you examples. See, I have one patient who is ovarian, failed ovarian. Ovaries means the ovaries completely shut down for her, and her age is just 30 years, nothing major. But still, this patient has come. But since she has come, she used to be very, very positive. Always she'll be happy and she will tell doctor, you do your best, I will get the results. Listening to her, even I am more boosted up. And then she got the result in same cycle. You don't believe this.
Oh wow.
Now she's carrying twins.
Oh wow.
And I
That's
have
lovely.
posted, yeah.
Double
I
good
posted
news.
this video, yes, on Insta. My Insta also, I have posted a small clip of their videos. If viewers want, definitely they can follow me
Yes,
on Insta also.
definitely.
So, as I told you, this counseling, we are taking care of counseling session. And yeah, financial, it's not like everything will come all together. This is kind of a 3 months procedure if you are going for IVF. So, the finances will be break. You can have some breaks in between.
I think that is all for the questions we have today. I think just to reiterate our discussion, we've discussed, finding out the root cause of infertility. We've talked about female and male factor diagnosis. We've also very heavily reiterated in all conversations about lifestyle changes, and also about, being positive and expecting good things to happen. I think that's life advice from you, doctor. I think if you have a positive outlook, then things do work out. And a great big shout out to the team at Kinder for being so lovely to all patients. To everybody attending, we will be dropping in a free consultation link on the WhatsApp group as well as this video's description. Please be sure to book an appointment with Dr. Nidhi, and I'm sure she will answer all your questions and give you the clarity that you need. Thank you, doctor.
Definitely,
Thank
I'll
you so
be
much.
happy to talk to them, and I'll be thanking all of them to joining us in weekday, taking
Yes,
out time.
definitely. And thank you to you, doctor, as well. I'm sure you had a long
Thank you
day.
so much.
Thank you. Thank you so much to
Okay,
all the viewers.
okay,
Thank
dear.
you.
Yeah, bye bye.
Bye bye.